Hi, this is Dr. Susan Sarajari from Dominion Fertility, and I just briefly wanted to talk about why we assess the fallopian tubes during a fertility evaluation. Now, the fallopian tubes are very important because the tubes are basically where the egg and sperm meet, and if the tubes are not open or patent, the egg and sperm can't meet. So basically what happens is an egg gets ovulated, the fimbriated end, which is the finger-like end of the tube, picks up the egg is transported into the tube, and then when the patient has intercourse, the sperm goes into the uterus and then into the tube, and hopefully the egg and sperm meet and make an embryo. If there is an issue with the tubes, and the tubes are, for example, blocked or partially blocked, then the egg and sperm can't meet, or the embryo gets stuck in the tube instead of going into the uterus, and then we have an ectopic pregnancy. Now, tubal damage can be caused by many different things. For example, patients who had pelvic inflammatory disease or a sexually transmitted disease like chlamydia at increased risk for developing tubal disease. Endometriosis can also cause problems with the fallopian tubes. And if somebody already had an ectopic pregnancy and the tube is damaged, that can then contribute also to tubal factor infertility. Patients who have fibroids can also have blocked tubes. The fibroids can be in such a position that the tubes can be blocked from that. And then patients who have had surgery and then scar tissue afterwards can have issues with their tubes. And then, of course, if somebody had a bilateral tubal ligation for birth control, then obviously the tubes are blocked. So it's really, really important to assess your fallopian tubes. Now, another reason we assess the fallopian tubes is to make sure there is no fluid or liquid in the tubes. Because if that is the case, then we actually need to either sever the tubes from the uterus or take the tubes out completely, because success rates to conceive, particularly with IVF, are decreased over 50%. So the way we assess the tubes is with an hysterosalpingogram, also known as an HSG or a dye test, where we basically instill dye through the vagina into the uterus, and then we take specialized X-ray pictures known as fluoroscopy, and if the tubes are open, we actually see the dye flowing out of the tubes. So I hope this is helpful. Again, this is Dr. Susan Sarajari from Dominion Fertility. Thank you so much.
Dominion Fertility, making miracles happen, one family at a time.